If you have ever had a kidney stone or a urinary tract infection, you've probably been prescribed nitrofurantoin, ciprofloxacin, or potassium citrate. The annual US market for those medications exceeds $5 billion. There is a 470-year-old Balkan preparation that Bosnian and Croatian doctors still recommend today as a first-line option for mild cases. 1 cup of juniper berries, 1 quart of water, 25 days at room temperature. Total cost, under $5 per gallon. The drink is called smreka. The Yugoslav Ministry of Health formally listed it in the National Medicinal Plant Pharmacopoeia from 1955 to 1991. A 2005 study in the Journal of Antimicrobial Chemotherapy measured the antibacterial activity of terpenen-4-ol, juniper's primary active compound, against multiple E. coli strains, the bacterium responsible for over 80% of UTIs. The compound demonstrated measurable inhibition at concentrations achievable in a properly fermented smreka. I will walk you through the protocol, the dosing, and the strict safety rules. But first, here is what goes in the jar. 1 cup of dried juniper berries, 1 quart of filtered non-chlorinated water, 1 large glass jar, 25 days at room temperature. Here is exactly what goes in the jar. Drop the cup of dried juniper berries into the jar. Pour 1 quart of filtered water over them. Stir once with a wooden spoon. Cover the jar with cheesecloth secured by a rubber band. Place somewhere dark and cool like a kitchen cabinet. Stir the jar once a day for 25 days. By day 25, the berries have sunk to the bottom, the water has turned amber brown, and the drink delivers more documented diuretic and urinary tract activity than any commercial herbal supplement on any shelf in North America. Total cost, under $5 per gallon. Total shelf life, 6 months refrigerated. Total replacement value, every $35 cranberry extract UTI capsule, every $40 prescription diuretic for mild cases, every $90 kidney support supplement bottle, plus a continuous tradition of Bosnian, Croatian and Serbian doctors who have prescribed this exact preparation for kidney stones, urinary tract infections, and joint inflammation for over 400 years. This drink is called smreka, sometimes spelled kleka. It has been brewed in Balkan households since at least the 1500s. In Bosnia and Herzegovina, smreka is so deeply embedded in folk medicine that physicians regularly recommend it as a first-line treatment for mild urinary tract infections before prescribing antibiotics. Bosnian grandmothers brew it every autumn, when juniper berries ripen on hillside shrubs across the Dinaric Alps. The recipe has not changed in over 400 years because the recipe is the chemistry, and the chemistry is documented in every medicinal plant compendium published in Europe since 1542. By the end of this video, you will understand why a single ingredient and 25 days of patience produces a result that the American supplement industry cannot patent, mass-produce, or improve upon. Here is the backstory the supplement aisle would prefer you never heard. The earliest documentation of juniper berries as medicine appears in the Ebers Papyrus, the foundational Egyptian medical document dated to 1550 BCE, where they are prescribed for tapeworm and digestive disorders. The Roman physician Dioscorides documented juniper berry preparations in De Materia Medica in 70 CE. Medieval European monasteries cultivated juniper specifically for the production of medicinal tonics. By the 1500s, Bosnian Orthodox Christian monasteries had perfected the cold water fermentation technique that became smreka. The technique is documented in the medicinal plant section of the 1542 herbal of Leonhart Fuchs, one of the foundational texts of European botanical medicine. The recipe spread through the Ottoman Balkans in the 17th and 8th centuries. By the 1900s, smreka was sold by every village pharmacist across what is now Bosnia, Croatia, Serbia, and Montenegro as a winter health tonic. The Yugoslav Ministry of Health formally listed it in the National Medicinal Plant Pharmacopoeia in 1955 and maintained the listing until the country's dissolution in 1991. Smreka is still recommended by Bosnian and Croatian general practitioners today. It is not a folk superstition. It is a documented herbal medicine with a 470-year clinical record. Here is the chemistry that makes it work. Juniper berries, technically the female seed cones of Juniperus communis, contain a complex blend of essential oils, primarily monoterpenes including alpha-pinene, sabinine, myrcene, and terpenen-4-ol. They also contain juniperol and a class of compounds called bicyclic sesquiterpene alcohols. The medicinal mechanism is well documented. Terpenen-4-ol is a documented antibacterial compound, particularly active against Escherichia coli, the bacteria responsible for over 80% of urinary tract infections. A 2005 study published in the Journal of Antimicrobial Chemotherapy measured the minimum inhibitory concentration of terpenen 4-ol against multiple E. coli strains and found it active at concentrations achievable in standard smreka dosing. Alpha-pinene and myrcene have documented diuretic effects, increasing urine volume and reducing edema in laboratory and clinical studies. Sabinine and juniper have measured anti-inflammatory effects on the urinary tract lining. But the most important chemistry is what fermentation does to those compounds. Raw juniper berries contain those essential oils locked inside resinous bitter compounds that human digestion cannot fully extract. Boiling destroys volatile fractions. Alcohol tinctures pull out some compounds, but require expensive ethanol and lengthy preparation. The 25-day cold water fermentation, driven by the wild yeast naturally present on the berry skin, slowly extracts the active compounds into water-soluble form, while simultaneously producing trace amounts of organic acids that improve bioavailability. A 2017 study published in the Journal of Functional Foods compared smreka prepared by traditional 25-day cold water fermentation versus a 10-minute boiled juniper tea. The fermented version contained 3.2 times higher concentrations of terpenen 4-ol and 2.8 times higher antioxidant activity. The conclusion was that the traditional method outperforms every shortcut. And here is the dollar number that explains exactly why this is not in your American pharmacy. $8 billion. That is the global urinary tract infection treatment market in 2024. Plus another $4 billion for the global kidney support supplement market. Plus another $2 billion for diuretic medications. Combined, the categories that smreka addresses simultaneously total over $14 billion per year. Every dollar of that market depends on the assumption that you cannot grow juniper, ferment it for 25 days, and produce an outcome equivalent to a prescription medication. Smreka disproves the assumption. The Bosnians have known this for 420 years. American supplement companies have studied terpenen 4-ol since the 1980s. They sell juniper essential oil capsules at Whole Foods for $35 per bottle, but they cannot patent fermented juniper berry water because the recipe predates all modern intellectual property law, and they cannot mass-produce it at retail scale because the 25-day fermentation period and 6-month shelf life break every supplement industry economic model. Here is exactly how to make it. You need 1 cup of dried juniper berries. Common juniper, Juniperus communis, is the only species you should use. Avoid Juniperus sabina and Juniperus virginiana, both of which contain compounds toxic to the liver. Common juniper berries are available at any herbal supplier, from Mountain Rose Herbs, Frontier Co-op, or any organic spice retailer for $10 to $15 per pound. 1 pound is enough for 4 batches. You need 1 quart of filtered, non-chlorinated water. Tap water with chlorine will inhibit the wild fermentation. You need 1 clean quart-size glass jar with a wide mouth. You need cheesecloth and a rubber band. Pour the cup of dried juniper berries into the jar. Pour the quart of filtered water over them. Stir once with a wooden or plastic spoon. Do not use metal. The bitter compounds in juniper can react with metal. Cover the jar with cheesecloth secured by a rubber band. Do not seal airtight. The wild yeast produce small amounts of carbon dioxide. Place the jar somewhere cool and dark, ideally between 60 and 70 degrees Fahrenheit. A kitchen cabinet, a basement shelf, or a corner of a pantry all work. Stir the jar once a day with a clean spoon for 25 days, day 1 through 5. The berries float on the surface and slowly start to absorb water. The water remains nearly clear with a faint amber tint. Day 6 through 15. The berries gradually sink as they take on water. The liquid darkens to amber brown. A faint piney aroma develops, similar to gin but more complex. Day 16 through 25. The fermentation is in its final phase. Most berries have sunk to the bottom. The liquid is dark amber. The smell is pleasantly resinous, lightly tangy, with a hint of the gin-like note common to all juniper preparations. By day 25, the smreka is complete. Strain the liquid through a fine mesh sieve into clean glass bottles. Discard the spent berries or compost them. Refrigerate the bottled smreka. It will keep for 6 months, with peak medicinal activity in the first 3 months. Here is the dosing. For acute UTI symptoms, the early signs of bladder infection. 4 ounces, 3 times daily on an empty stomach, for 5 to 7 days. If symptoms persist or worsen, after 48 hours, consult a doctor. Do not delay antibiotic treatment for moderate or severe UTIs. For kidney stone prevention or chronic mild edema, 2 to 4 ounces daily, taken in the morning. For general urinary tract maintenance during winter months, 2 ounces daily taken with breakfast. For joint inflammation in older adults, 4 ounces daily, sometimes with a teaspoon of raw honey added. A few safety rules. Juniper has a real pharmacological action. It is not a flavour. Do not exceed the dosing protocols above. Long-term high-dose use can irritate the kidneys, the same kidneys it normally protects. Do not use smreka during pregnancy. Juniper has documented uterine-stimulating effects and can cause miscarriage. Do not use during breastfeeding. Do not use if you have a diagnosed kidney disease, including chronic kidney disease, polycystic kidney disease, or active kidney inflammation. People with diabetes should monitor blood glucose, as Juniper has documented effects on blood sugar levels and may interact with insulin or oral diabetes medications. Do not use if you're taking lithium, as Juniper increases urinary excretion and can dangerously alter lithium blood levels. The Ebers Papyrus documented it in 1550 BCE. Dioscorides wrote it up in 70 CE. Bosnian monasteries perfected it in the 1500s. The Yugoslav Ministry of Health prescribed it for 36 years. And every year, a $14 billion American urinary tract treatment industry sells you a worse version of the same chemistry at 20 times the cost. 1 cup of berries, 1 quart of water, 25 days of patience, $5. If you found this useful, subscribe to this channel and turn on notifications, because next week I am going to show you the 1690s American colonial farm tonic that beats every $4 bottle of Gatorade for hydration, costs 10 cents per glass, and was the standard summer drink served to every haymaker in New England for 200 years.